Good morning!
Good morning, how are you?
I'm good. I'm Nurse Jeremy.
Nice to meet you.
And I will be...
And I'm patient James.
Alright, take a seat, Mr. James. Mr. Pastor, I should say. Let's see. I will be taking a health history for you. And thank you for choosing our hospital, by the way. And
You're
I
welcome.
hope that this history will get to know you better about your health.
That fits me well.
Alright, so let's just begin. Can I get your first initial and your last initial?
JP.
JP, alright, good. And your cell phone number that we can contact you by?
717-503-8024.
8024. Alright, there. And can I get your birth date?
January 22, 1946.
Alright, very good. And your birthplace?
Lawag, Ilocos Norte, Philippines.
Alright, got it. And then your age?
My age now is 66 and a half.
Okay. Marital status?
Married, happily.
Alright. And also your occupation as of recently?
Physician.
Alright.
Retired.
Retired physician.
Okay.
And how about your race, ethnic origin?
I'm Asian.
Asian. Alright.
And particularly from the Orient, Philippines.
Got it. Very good. Employer? Who would you say is your employer?
I was self-employed for the last maybe, I would say almost 10 years.
Alright. And today we are going to get to know your reason for seeking care today. Why did you come to the hospital?
The reason why I came to the hospital is I just want to have a follow-up on the cardiac event that I had on Labor Day weekend, September, that would be 2010.
Okay. So your cardiac episode in 2010.
Mm-hmm.
And you're pretty much doing a follow-up, you said?
That's correct.
All right.
To make sure that everything is, you know, up to par as far as my health is concerned, that I'm doing the right things, that I'm exercising enough, follow up about my medications, and if there are any things that I should do more or, you know, improve upon, then that I would be glad to know.
All right. How would you describe your present health?
My present health is relatively fine.
Okay.
And except for that episode that I had on that date that I just told you.
Okay, understood. And would you say that you have any present illness?
My present illness is what I have stated already, and the
Right.
chronic illness I would say is my aging process, and like what aged people have, and most especially the GERD that I have.
GERD, we'll get into that. Now we're gonna get more in depth about your past health, as you have been describing to me already. How would you describe your general health? And when I say general health, I mean throughout your lifetime. How would you describe it?
My general health is, I would say, pretty good in that it has allowed me to go to work regularly, and being able to do my regular exercise as often as I can, and being able to support a family of 5.
Excellent. How about any childhood illnesses?
As far as I could remember, childhood has been a long time ago. But the illnesses that I have as a childhood were, I had mumps.
Okay.
I had, I would say I had chicken pox.
Chickenpox, okay.
Which is known as varicella, right?
Oh, very good.
And then I had tonsillitis.
Okay.
I mean, repeated bouts of it when I was a child, but eventually I had tonsillectomy when I was much older. And I think that was it.
Okay, all right. Do you remember any accidents or injuries at any age?
Well, yeah, I had a dislocation of my right ankle
Okay.
at an older age than childhood, and I also had I also fell and I had abrasion on my right knee when I was about 6 or 7.
Okay.
That's I remember. And
Okay.
other than the falls that I had on my bicycle when I used to drive it to school and from school,
Okay.
there were kind of minor abrasions.
Okay, so those are pretty much accidents related to around your childhood.
Yeah.
Okay, do you have any serious or chronic illnesses?
I would say the chronic illness that I have is I may have, as you call, a chronic sinusitis
Okay.
that I am in the bad habit of using decongestant almost every night.
Okay.
And another chronic one is like what I mentioned already, the GERD
Mhm.
that I've been suffering from for the last at least 10 years, and I take antacid for it.
Okay.
And also my snoring.
Okay. So I have here chronic sinusitis, decongestants that you use for that, your GERD for the past 10 years. When did the chronic sinusitis first come about? At what age?
Oh, it came about in a very young age, even when I was in my 40s yet.
Okay.
And it has persisted. I think it has more to do with the influence of the change of weather. You know, having hay fever or the pollen that is more during
Okay.
the change of weathers.
Okay. What about your snoring? What age did that come about?
Oh, it came about at a very early age too. As a matter of fact, I could remember it as far as when I was still in high school,
Okay.
that I was known to snore loudly
Okay.
together with my dad.
Okay. All right. Any hospitalizations that you were in the hospital for in the past?
How far in the past do you want to know?
Let's start with the recent one, the most recent hospitalization.
The most recent hospitalization, like I have mentioned to you already, was the cardiac event. I had an MI or heart attack on the Labor Day weekend of 2010.
Okay.
That was the most recent. Before that, the more chronic one that I go to the outpatient or hospital for is my regular colonoscopy, which I have every 3 years.
Okay.
And I did have also, like I mentioned to you already, tonsillectomy with correction for my snoring.
Okay.
The exact date to that was maybe in the early 2000.
All right. Very good. So you already mentioned that you had a colonoscopy, so I can put that down as your operations. Okay. And what kind of operation did they do for your MI?
Well, it was just a procedure that they did at the cardiac lab when anybody would undergo such a problem. They brought me to the cardiac lab and did what they call coronary angiography.
Okay, very good.
And through coronary angiography, with that procedure, they put a stent on my right coronary artery that corrected the problem.
Okay. So that's that. All right. We are moving about. And any immunizations that you've taken recently?
My latest one is my yearly immunization for influenza,
Okay.
which I usually get in October.
All right. Anything else?
No.
Okay. And when was your last examination date?
What do you say examination?
You say you were in the hospital 2010 for your MI.
Right.
Anything more recent than that?
Oh yeah, my most recent, as a matter of fact, is just last Friday.
Okay.
When I had my pre-physical exam by my gastroenterologist.
Got it. Okay.
Because I am scheduled to have a colonoscopy on July, I think it's July 12th.
Okay. Very good. So that was just last week.
Mm-hmm.
What about any allergies? Do you have any?
I don't have any allergies that I could remember.
Okay.
I may have a reaction to Demerol in the early 1970s that made my blood pressure go down, but other than that, I wouldn't even count it as an allergy.
Okay. So So, and you mentioned Demerol. Would you say there was any reaction to the Demerol that you could?
Yeah, that was the hypotension that I had
Hypotension,
after
right.
they gave it to me.
Okay.
That was when I had my surgery for my lungs.
Okay. Are you taking any current medications?
Oh yeah, my current medications would be,
Okay.
I take Efient 10 milligrams daily.
Okay.
Oh, it's every other day now.
Okay.
I used to take it daily. But my cardiologist advised me to stop that when the medication is finished, and I will just stick into aspirin 81 milligrams daily.
Okay.
And then the other one would be famotidine, which is for the acid reflux. I take 20 milligrams twice a day.
Okay.
And then lisinopril, that would be for hypertension, which I take 5 milligrams once a day. And then metoprolol tartrate, 25 milligrams twice a day. And simvastatin for my cholesterol, 40 milligrams once a day. Together with that, I take vitamin supplements of vitamin A, vitamin D,
Okay.
and CoQ10
Okay.
and L-carnitine
Got it.
as nutritional supplies.
Very good. So you have all your current medications all there. Would you specify any family history problems? I'll just begin with any heart disease.
No, I don't have any history of heart disease.
What about high blood pressure?
I would say my mother was afflicted by it.
Okay. Stroke? Anyone else in your family?
No, nobody in the family had stroke.
Okay. Diabetes?
No.
No? Okay.
There's no family history of diabetes either.
Okay. Blood disorders? Like
No.
sickle cell- Okay.
No blood disorders.
Breast, ovarian cancer?
No, none of us in the
Okay.
history has ovarian
What about any other kind?
cancer.
Well, okay. What about any other kind of cancer?
Well, like I mentioned before, my father died of cancer of the appendix when he was 75.
Okay.
And some related members of my mother's side died of cancer of the GI, you know,
Okay.
when they were already aged,
Okay.
more than, I guess, they died when they were more than like 18 years old.
All right. What about arthritis?
Arthritis, I think arthritis is a very common history that any family would have when they are above 60. I have a cousin who had gout, cousin on the mother's side.
Okay.
You know, you're talking about first degree cousin, the son of my mother's sister.
Okay.
And some other, the one recently I met when we were on our vacation to Hawaii, with the same category of relationship, suffered from arthritis, but they claim to be okay now.
All right. What about any allergies of other family members?
No.
Okay. Asthma?
History of asthma. My sister had asthma when she was a child,
Okay.
but she outgrew it when she became a teenager.
Very good. Obesity. Would you say that runs in the family?
I don't think that's hasn't been in our family, obesity growing up.
Okay.
No.
What about alcoholism or drug addictions?
No,
Okay.
not in our blood relatives.
Mental illness?
No, I wouldn't think that we had a hereditary mental illness, I would say.
Okay. What about suicide?
No, we don't have. When you are kind of depressed, you may have that kind of feeling sometimes, but there's no, I would honestly say that there was no clinical depression history in our family, you know,
Okay.
outside of things that there may be incidents that happen in your life that may lead you to that, but as far as genetic relationship to our family,
Mm-hmm.
there is no history of clinical depression with suicide.
Okay, would you say there's any seizure disorders here too?
No, I would think it's an isolated incident that one of my kids has one.
Okay. Kidney disease.
No.
Tuberculosis?
No, even though we were exposed to it when I was in the Philippines.
Very good. Okay, so that clarifies all the family history. Now we're going to go into your systems part, beginning with, let's see here, circle, okay. General overall health state. Okay. Can we, general overall health state. Your present weight, would you say that,
Oh, yeah, it's been stable from, I would say, 145 to 148, 49.
okay,
And currently it's 147 pounds.
do you have any problems like gaining or losing weight?
No,
Okay. What about your diet? How would you say your diet affects your health? Is it been imbalancing or?
yes, my diet affects my health in the sense that when there's a disturbance of the regular diet that I have at home, like when you go on vacation and stuff like that, it leads you to less immunity to regular diseases like colds and cough.
Okay. Regarding your overall health, would you say you feel a lot of fatigue?
I think you're saying regular health?
Yes, your overall.
My overall health, I think, is good in the sense that I don't have any disease that incapacitates me to do the things that I want to do, either routinely or the things that I must do.
Okay. Would you say that your overall health revolves around much weakness or malaise?
No,
Okay. How about fever or chills?
no, I don't have that.
Sweats or night sweats?
I don't have night sweats.
Okay. Let's talk about your skin. Would you say, do you have any history of any skin disease? For example, eczema, psoriasis, or hives?
No, I don't have any skin chronic disease that I can remember.
Okay. Any pigment or color changes that you've noticed?
No.
Okay. What about a mole or change in a mole?
No, I don't have any mole that,
Okay.
except I guess these moles that I have while I grow old.
Okay. Excessive dryness or moisture?
No, I don't have that. I would
Prurite.
say those dryness and moisture is related to change of climate.
Okay. What about pruritus?
No, I don't have any itching.
Okay. What about any excessive bruising?
No, even with my history of some anticoagulants and my medical things, medicines that I take. Fortunately, the most that I have sometimes is nosebleeds, which I would relate to anticoagulants that I've been taking. But other than that, I don't have any chronic bleeding.
Okay. What about any rash or lesions?
Any what?
Rash?
Oh, rash. No, RASH. No, I don't have any rashes.
Okay. Let's talk about your hair. Would you say that you've experienced a recent loss over it, or is that a problem?
No, I think we lose hairs daily.
Okay.
I don't have any excessive loss of hair,
Okay.
even though I would say I have less hair now than when I was younger.
Yeah. Okay. What about any change in texture of your hair? Like anything out of the normal you wouldn't expect?
No, I don't have that.
Okay. All right. Your nails, have they changed in shape?
No, I don't think so. There's no.
Okay. What about their color?
No, there's no change in color. They have been pinkish.
Yeah.
And
They don't look very brittle.
No, they're not brittle.
Very good. Have you been noticing any? How should I phrase this? Okay. What about the amount of time you spent in the sun?
Oh, sun exposure.
Mm-hmm.
I am not a sun worshiper, so to speak, in the sense that
Okay.
I don't enjoy going to the beach and really tanning. That's not my
Okay.
habit. Uh,
But when you do you apply any skin protective?
yes, when I do, I would.
Okay.
But like I said, I don't routinely do that.
All right, very good. Let's talk about your head. Any unusual, frequent, or severe headaches?
No,
Okay. Any head injuries that you've had?
no, I haven't had any head injuries recently.
Okay. Do you experience any dizziness? Also syncope?
No,
Okay.
no syncope or dizziness.
What about vertigo?
Vertigo, no.
Okay, very good. Let's talk about your eyes. Do you have any difficulty with vision?
Well, I have been wearing glasses
Okay.
for a while, and the most recent changes to glasses is that the grade on my far distance have been changing more often than I thought recently. And as a matter of fact, I plan to see my optometrist again sometime this week, hopefully, to maybe change the grade of what I could see on the
Okay.
distance.
So even with your glasses, would you say you have any decreased acuity or blurring?
No, with my glasses,
Okay.
I can see well.
Or blind spots? Do you have any blind spots significantly?
No, I don't have any blind spots.
Okay. Any pain in your eye?
I haven't experienced any pain in my eye.
Okay. What about any double visions known as diplopia?
No, I haven't. I don't have any diplopia.
Okay. Redness or swelling in your eye?
Well, I think I had some redness and swelling on my eye on my vacation to Hawaii last month,
Okay.
but it subsided without any treatment to it. I think it's more associated with exposure to environment.
Okay. And have you experienced any watering or discharge from your eye?
No.
Glaucoma or cataracts?
No, I don't have any glaucoma, hopefully.
Okay.
The last test that the optometrist did on my eye, she didn't find any glaucoma. And I may be, because of my aging, I may be having some cataract opacity somewhere, but I cannot, so far it hasn't affected my vision.
All right, fair enough. Let's talk about your ears. Have you experienced any earaches?
No. The only recent thing that I had with my ear was accumulation of wax,
Okay.
and that has been corrected by irrigation by my otolaryngologist, which was done at least a couple of months back. And since then, I didn't have any problems with hearing.
Very good. So, have you had any ear infections?
No.
Okay. What about any discharge from it, or any characteristics of the discharge?
No,
That you
no
can describe.
discharge from the ear.
Okay. Tinnitus, ringing of the ear,
No, I don't have ringings of the ear.
and you already said that you have no vertigo as well.
No,
Okay.
no vertigo.
And are you using any hearing aids?
No,
Okay.
fortunately not yet.
Okay. So I think this is good. How do you clean your ears?
I clean it with Q-tips
Okay.
when I take a shower, after I take a shower.
All right.
And I don't know if that should be enough, because I have been doing that for years, and
Mhm.
still there are wax that accumulates.
Well, wax isn't necessarily a terrible thing for your ears. Okay. We will move on to your nose and sinuses.
Sure.
Discharge and any characteristics of the discharge? Any from your nose? Would you say you have? any?
No, I don't have any irregular discharge there.
Okay.
Aside from occlusion that comes with a change of weather sometimes, and some, like I said before, I sometimes suffer from chronic rhinitis.
Got it. Okay. Would you say you have any unusual frequency of your colds?
I wouldn't say unusual frequency,
Okay.
but customarily I tend to occlude my nose more during winter.
Yeah. All right. When you have these episodes of sinusitis, would you say there's any significant pain along with your sinus pain?
No.
With your sinusitis, I should say.
No, sinusitis is usually characterized with headaches, especially in the morning,
Okay.
but I don't have that.
Okay. Any nasal obstruction, like difficulty breathing through it?
Well, I do have nasal obstruction, especially when I wake up, you know. That is why which may not be a good habit, I chronically use nasal decongestant,
Right. You mentioned that.
you know, before I go to bed.
Okay. Let's see. Have you had any changes in the sense of your smell?
No,
Okay. So that's been pretty consistent with you.
yes.
Let's move on to your mouth and your throat. Do you have any mouth pain?
No, I don't have any mouth pain.
Okay. Frequent sore throats?
I wouldn't say my sore throat is frequent.
Okay.
The last one I had was about a month ago.
Okay. What about any bleeding of the gums?
No,
Okay. Toothaches?
no, I have been good with my teeth.
Good.
Whenever I do my regular brushing and my regular flushing of the teeth,
Ha-
when I use my pick,
Uh-huh. Your water pick? Okay.
yeah.
What about any lesions in your mouth?
No, I don't have any lesion from my mouth
Okay. Or your tongue?
on my tongue. not
Okay.
yet.
What about any dysphagia?
No, I don't have any loss of voice or dysphagia. I've been when I was having this maybe upper respiratory infection that I thought I had about about 3 weeks ago. I was I thought losing my voice
Okay.
a little bit, but other than that, I don't have that problem for a while.
Okay. Have you had a tonsillectomy?
Yes, I had a tonsillectomy with UPPV.
UPPV.
Yeah, that would mean uvulopalato-pharyngoplasty. This term is used for correction for snoring,
Okay.
and that was done in the early 2000s, maybe 2003 or 4, just after they did my removal of the gallbladder, also 2 years before that.
Okay. Would you say you have any altered taste in your mouth?
No,
Okay. And you mentioned your dental care, and you use. Do you use any dentures?
no, I don't have any
Okay.
dentures.
And do you know when your last dental checkup was?
I usually have dental checkups no more than every 6 months.
Okay.
And I would say I had my checkup within the last 6 months.
Okay. Talking about your neck, do you have any pain with your neck?
No, I don't have any pain in the neck
Very
right
good.
now.
Limitation of motion?
No, I don't have limitation of motion.
Lumps or any swelling on your neck?
No, I don't have any lumps or swelling from my neck.
And is it safe to assume that you have no enlarged or tender nose?
No, yeah, it's safe to assume that I don't have that.
Okay.
I feel like I don't think that my thyroids are enlarged, or do I have any lymph nodes
Okay.
on my neck?
And a no to a goiter?
No.
Okay. What about around your chest? Do you have any pain, specifically like your your breast or your chest area?
No, I don't have that.
Okay, no lumps or
No lumps
have you
on my chest.
ever
Fortunately.
experienced any nipple discharge?
No, I don't have that.
What about any rashes?
Rashes from my chest? No, I don't.
Do you have a history of breast diseases?
No, I don't have.
Any surgery on your breasts?
No surgery in my breast.
All right. Talking about your around this axillary region, do you have any tenderness, lump, or swelling or rash?
No, I don't have.
Okay. Let's see here. Do you know how to perform, even for men, a breast self-exam?
Breast self-examination.
Yeah.
I haven't been instructed how,
Okay.
but as far as I know, I don't have any lumps or, tenderness when I touch my breast.
Very well. We are moving right along. If you ever need a drink of water, there's water there for you too.
That's all right.
Okay, moving to your respiratory system, let's talk about any history of any lung disease. Have you had any asthma, emphysema, bronchitis, or let's just start with asthma.
First of all, I don't have any history of asthma.
Okay.
And the only significant history as far as my lungs are concerned is on the, I think on the summer of 1971,
Okay.
after graduation from medical school, I developed spontaneous pneumothorax.
Okay.
And because of that, I eventually was confined in the hospital, and it was a spontaneous pneumothorax on my right side, where in x-ray it finally was found that about 2/3 of my lung was collapsed towards the middle. And so a tube was inserted on my right side, which was draining, which is purpose is to drain the air from there to
Right.
expand my lungs. But then I was told by the doctor finally that it would take too long to have that re-expanded. And so they finally decided to do a procedure called right open thoracotomy. And the procedure ended up to be the plication of blebs that led to the expansion back to my lungs, to its original size. So that was kind of a more or less life-saving procedure.
Okay.
So I was there in the hospital for about no more than a week, about maybe 3 or 4 days for it.
Okay. Very, very good. When talking about your current respiratory status, how much activity does it take for you to finally produce shortness of breath? Like, is it something like just walking upstairs, you'll...
No, I don't have any limitations of breathing
Okay.
on any activities, except if I were to be forced to maybe go to a place where it's too steep and I have to go there quick,
Okay.
then I would develop any difficulty or shortness of breath. But other than the normal, I could still
Very
do
good.
it.
Okay. As of recently, have you developed any coughs?
The last episode of coughing was like 3 weeks ago.
Okay. Did you cough up any sputum?
Yes,
What color would it be?
it was. Sometimes it was like yellowish,
Okay.
But other than that,
Would you say it would be mild, moderate amount, a large amount?
I think it was. It started from. I would say moderate to slight, and then eventually it went away.
Okay. Have you had any toxin or pollution exposure?
No,
Okay. And would you say your last chest x-ray was back in 1971? or?
Oh no, I had my chest X-ray sooner than that. For routine exam, I guess it's not recent, but
Okay.
I must have had it at least for once in the last 10 years.
Okay. Moving on to your cardiovascular system, would you say you have any precordial or retrosternal pain?
Well, not lately.
Okay. Do you experience any palpitations?
Very occasionally, I
Okay.
would say. No more than 2 or 3 times in 6 months.
All right. Episodes of cyanosis?
No.
Okay.
Cyanosis would be bluish discoloration
Exactly.
of the lips. And no, I haven't experienced cyanosis.
Okay. Are you experiencing any dyspnea on exertion?
No.
Okay. What about any orthopnea?
That's dyspnea when you are flat on your back. No, I don't have orthopnea.
Okay. Do you experience paroxysmal nocturnal dyspnea?
No, I don't have.
What about any edema?
Edema in the legs, I don't have that.
Okay. History of heart murmur?
No.
Hypertension?
Yeah, I do.
Okay.
That's why I take metoprolol and lisinopril now.
What about coronary artery disease?
Well, I would say I have that
Okay.
because of my history of myocardial infarction in 2010.
All right. Anemia.
No, I don't have anemia.
And your last EKG or other heart tests?
My last EKG was taken. As a matter of fact, it was even better than that. I had a nuclear stress test in April.
Okay.
Okay, so that would consist at least with an EKG
Yeah.
and EKG while you are exercising, and on top of that they give you a nuclear element on your body to see the function of your heart while you're at rest or exerting.
Okay. How were the results?
It was very favorable. They found that my ejection fraction was in the 60s, 60 or 65 range, which is really normal for individuals. And it's impressive considering the fact that I did have an MI in 2010. So obviously my cardiologist said that there's not much damage or no damage done to the heart from my recent cardiac event.
Okay. Moving on to your peripheral vascular system, do you experience any coldness?
Coldness in my periphery.
Yes, like your extremities.
My extremities, no, I don't experience any
Okay. In the
coldness
same
in
category,
extremities with my legs.
what about numbness or tingling?
Numbness or tinglings on the legs, I don't regularly experience them.
Okay. What about swelling of the legs?
No, I don't have swelling in the legs
Or arms too?
or arms.
Okay. Any discoloration in your hands or feet?
No, I haven't experienced discoloration of my hands and feet.
Okay. Nothing like bluish
No.
or pallor. Okay. Let's talk about, do you have any varicose veins?
No, I don't have varicose veins.
Okay. Intermittent claudications?
I don't have any intermittent claudication, meaning pain in the legs at rest.
Good. What about any thrombophlebitis?
No, I don't have inflammation or infection of my
Okay.
veins.
And any ulcers?
Ulcers where?
In your extremities or
No, I don't
anywhere?
have ulcers in my extremities.
Okay. Let's see. Avoid. Okay. Let's talk about your GI system. Beginning just with your appetite. Would you say?
Oh, my appetite is fairly good.
Okay, good.
I get hungry when I don't eat.
All right. Food intolerance.
I tolerate all the food that I'm supposed to eat.
Okay. Any dysphasias?
Dysphagia, you mean?
Dysphagia, sure.
Yeah, difficulty swallowing. No, I don't have difficulty swallowing.
Okay. Heartburn.
Yes, I do have heartburn.
Okay. Indigestion.
I don't experience regular indigestion.
Okay. Pain associated with eating.
I don't have pain when eating.
Okay. Other abdominal pain.
No.
Okay. Pyrosis, esophageal and stomach burning sensations.
No.
Okay. Let's say nausea and vomiting. Have you? Are you
No,
experiencing?
I don't have nausea vomiting.
Okay. Vomiting blood.
Oh no.
Okay. Do you have a history of abdominal disease?
You mean inside?
Yes.
Yeah, I have. I already mentioned to you the acid reflux, which is
Right.
attributed to hiatal hernia.
Okay.
They told me that when I had my cholecystectomy,
Mhm.
removal of the gallbladder, laparoscopic, the surgeons told me that I do have hiatal hernia, which contributes to the reflux.
Okay.
And then in one of my colonoscopies, they also found that I did have polyps, and that's the reason why I have it every 3 years. And also I have diverticulosis.
Okay.
And I had an attack once of diverticulitis, which is an infection or inflammation of the diverticulosis, which is a severe pain on the left side of your abdomen.
Okay.
I must have had that about 5 years ago.
Okay. Flatulence.
No.
Okay.
I don't have flatulence.
Frequency of your bowel movement. Would you say it's
No, I don't have frequency. I go to the bathroom almost the same time during the day. That's waking up every day in the morning.
okay? Any recent changes in your stool?
No, I don't have any recent changes in my bowel habits,
Okay.
or the consistency of my stool.
What about constipation or diarrhea?
No.
Okay. You mentioned no change in stool, so black stools is that?
No, I don't have black stools.
Okay.
Occasionally, I may have a stool tainted with a little blood because
Okay.
on top, aside from my GRD and that they find it, I also have internal hemorrhoids.
Okay. And rectal bleeding, specifically in the rectum.
Yeah,
Could you-
that comes with the hemorrhoids.
Okay. And what do you use? Do you use anything such as antacids?
Yes,
Or what about laxatives?
I don't use antacids, but I do take antacids regularly.
Okay.
In this case, the famotidine that I told you before.
Okay. Very good. Let's talk about your urinary system. You experience frequency?
At night, I at least go to the bathroom during my night rest. I go to the bathroom at least 3 times a night.
Okay. What about any urgency? Like the urge to go, but you can't?
No, I don't have hesitancy.
Okay. What about dysuria?
I don't have pain during urination.
Okay. Let's see. Polyuria?
That's frequently going to the bathroom. No, not unless I drink more water, then I go to the bathroom more.
Okay. Let's see. Narrowed stream.
No, I don't have any narrowed stream
Okay.
in urination, which would denote some stenosis in the outlet or...
How would you describe your urine color? Such as?
It is amber yellow
Okay.
and clear.
Okay.
And it's more, of course, concentrated when I drink less water.
All right. Okay. History of any urinary disease?
No, I don't have any history of urinary disease.
Okay. Like kidney or kidney stones.
No, I don't have any
UTI.
kidney stones.
Very good.
Uh,
Do you experience any pain in your flank?
no.
Okay. What about in your groin?
In my groin, no.
Okay. What about your suprapubic region?
Suprapubic pain, there's not.
Okay. And your low back? Any pain?
Low back pain, no, I don't have.
Okay.
I may have it occasionally, but I would think it's associated to more on maybe degenerative arthritis of my spine.
Okay. Let's talk about your genital system.
Okay.
Would you say that your penis or any testicular region has any pain?
No,
Very good. Sores or lesions?
I don't have any lesion in my genitals.
All right. Any penile discharge?
I don't have.
Lumps
No lumps.
and hernia?
I don't have any hernia.
All right. Do you know how to perform a testicular self-exam?
Yes, I happen to know that. You go around your testicles. I think you should have a self-examination of it to examine for extra lumps on your testicles and to compare the sizes of ball.
Okay. How frequently?
Well, I do it when I'm more self-conscious about it.
Right.
Maybe I'm not doing it as often as I should.
Okay.
But maybe we should all examine our testicles at least once a month.
Okay. You have good awareness. Moving right along, we're going to talk about your sexual health.
Mm-hmm.
Are you presently in a relationship involving intercourse?
Yeah.
Okay. Are aspects of sex satisfactory to you and your partner?
Well, I think I would attest to the funny quotation that marriage, if you do sex too often, that's why marriage was created.
Okay.
Because marriage usually there's less sex involved when you're married already.
Okay.
And it has been advocated that the more sex you have, the better it is, even to your cardiorespiratory system, because it improves
Interesting.
your circulation and your exercise routine, and it promotes a better relationship. And most marriage, unfortunately, has gone to the slow mode when it comes to sexual or intercourse in their experience.
All right. Any changes in erection or ejaculation?
No.
Okay. Do you use any contraceptives?
First of all, it's not necessary to use any contraceptives at this age.
All right.
My wife being, I think, 60.
Okay. So.
The answer is no.
All right. Good. So that can knock off all these questions. Aware of any contact with partner who has sexual transmitted infections?
No, I am a monogamous husband.
Very good. Let's talk about your musculoskeletal system.
Okay.
I understand that you mentioned already that there's not much of a history of arthritis or gout, but
No.
you said in your wife's cousin said has gout.
No, my cousin, myself.
Your cousin. Okay.
Yeah.
What about in the joints? Any pain or stiffness?
Well, like I said before, at this age, you do have stiffness sometimes when you wake up, and I think I attribute that to mostly from lack of enough exercise. Because whenever I get to my exercise routine, and I do it, I don't experience any pain in my joints.
All right. Would you say there's any deformity in your joints?
No, I don't have any deformity in my
What
joint.
about, do you find any limitation of motion?
I don't have any limitation of motion in all my joints.
When you move your joints, do you hear any noise?
Well, except for the occasional cracks
Okay.
when you kind of flex and extend it.
Okay.
I think I don't have any unusual noises.
Okay. In the muscles, do you experience any pain?
No, I don't have any pain in the muscles.
Cramps?
Cramps, no, I haven't experienced cramps lately.
Have you experienced any weakness with your muscles, like maybe lifting up an object or moving?
Well, again, I haven't had that lately either.
Good. Any gait problems?
No, I don't have any hesitancy in my gait. I think my gait is well
Okay.
for now. No pain.
Also, your coordinated activities, such as maybe just throwing a ball or that.
I guess I'm fine with that.
Okay.
I just need to do more of it.
Okay. In the back, we talked about your lower back pain as well. But
Right.
generally, any location in your back, any pain?
Yeah. I have. I do have in my history a chronic pain problem
Okay.
on my back, and I experience that mostly when I lack exercise.
Okay. Would you say there's any stiffness or limitation of motion with your back?
It's more sciatic in distribution, and I do have pain on my right hip. And like I said, I experience that especially when I lack exercise in my daily life.
Okay. How much walking per day?
Well, there's always room for more. I believe I don't walk enough per day, but when I get a chance, I do in the machine. Do you call that machine that we have?
Treadmill?
No. What's this machine that we have upstairs? Huh? It's a.
Oh yes. Yes, that machine.
Yeah, I try to do like at least 3 miles of that
Okay. Very good.
every day if I can. And if I don't do it, I think that's when the other pains come in.
Okay. Let's see. Neurologic system. History of any strokes?
No, I'm lucky enough to have any strokes so far.
Okay. Any fainting or blackouts?
No, I don't have any of that.
Okay. Any weakness
Fortunately.
or tick or tremor?
No, I don't have any tremors, no weakness on any limbs.
Paralysis.
No, I don't feel any paralysis except that I think coming with the back pain, I have some numbness on the lateral side of my left leg, and I have had that since the early 80s already, and I have learned to live with it.
Okay. And do you experience any paresthesia? Such as numbness and
Paresthesia?
Numbness and tingling?
No.
Okay. What about your cognitive functions? Would you say that your memory is serving you well, or do you feel disoriented sometimes?
It's not so much of disorientation as sometimes I have problem recollecting recent events. Like for instance,
Okay.
I would give you an example. Sometimes I don't know where I put my car keys
Okay.
or the pens that I usually use. I misplace them a lot.
Concerning your mental status, would you say you experience any nervousness or extreme mood changes?
No, I haven't had experience that, but occasionally everybody goes through that.
Okay.
Change of modes depending upon what kind of stress you have in
Okay.
life.
Are you experiencing any hallucinations?
Oh no, I don't experience hallucinations.
Okay. Are you experiencing depression?
Right now I'm not.
Okay. Now we're going down to our last two systems. tricky word,
Okay.
system. Any bleeding tendency of skin or mucous membranes?
I think I would say I occasionally have bleeding tendencies from my nose.
Okay, the rhinitis. Okay.
Yeah.
Excessive bruising.
No, I don't have excessive bruising.
Okay. We covered your lymph nodes.
And I think if I should have any bruising, I would attribute that to whatever medications I'm taking right now.
Okay.
Aspirin
Mm-hmm.
and the one that I mentioned to you, the one that I should finish when I finish my prescription.
Ephia.
Ephia.
Okay.
Yeah.
Let's see. What about any blood transfusions? Have you taken any?
I was told that I did have a blood transfusion when I had my. I might have had it when I had my chest surgery
Okay.
way back in 1971.
Okay. Did you experience any abnormal reaction?
No, I didn't have any reaction to it.
Very good. Endocrine. History of diabetes. We said you.
I don't have. There's no study. There's no history of diabetes in the family.
Okay. Have you had yourself a history of thyroid disease?
No.
Okay.
Even though it's worth mentioning at this point that my sister
Okay.
is being booked for total thyroidectomy
Okay.
on the 26th of this month,
All right.
and that's a big surprise to all of us.
Okay. Do you experience any intolerance to heat or cold?
No, I don't have.
Okay. Do you have any change in skin pigmentation or texture?
No,
Okay. What about excessive sweating?
I don't have excessive sweating.
Okay. Do you have any abnormal relationship between your appetite and weight?
No.
Such as, okay.
My weight has been consistent
Okay.
lately.
Abnormal hair distribution.
Well, I'm balding on this top
Okay.
of my head.
Other than that, that's pretty
Other
much
than
just
that, that's pretty much.
okay. Normal. Okay. Do you experience any extreme tremors or nervousness?
No,
Okay.
I'm not experiencing that right
So
now.
you are in no need of hormone therapy.
I don't think so.
Okay. So that covers the systems. Now we're gonna go in your functional assessment. How you're functioning. Your self-esteem, and also known as your self-concept. Let's talk about your education. What was the last grade or degree that you completed?
Oh, the last grade that I completed was medical school. I graduated Doctor of Medicine in 1971.
Okay. What about your financial status right now? How's the income? Is your income adequate for your lifestyle?
Well, so far it's been adequate,
Okay.
and I just retired at the end of 2011,
Okay.
and we are being sustained just from my savings and from social security checks and unemployment checks.
Okay. Value belief system. Would you say you have any religious practice that you would claim? Or religious?
Yeah, since I've been trying to be more active in my religious affiliation with the Seventh-day Adventist Church, in my home church in Harrisburg First Seventh-day. By being more active, meaning I want to be more involved with, especially in evangelism, which we are looking forward to have this coming October.
Okay.
I presently am and have been an elder of the church for many years, and I've been a Sabbath school teacher for as far as I could remember.
Okay, very good. And talking about your self-care behaviors, how do you picture yourself going about the day, how you take care of yourself? What would you say?
Of course, I look at it as something that needs improvement all the time.
Okay.
Self-care, as far as I can see right now, I really need to be more consistent with my exercise and to look more in my diet. As far as eating habits is concerned, I guess there's always room for improvement in having more fruits and vegetables and less on processed food and meat for that matter.
Okay. Very good. I'm running low on my ink. Can I borrow your pen?
Sure.
Oh, very good. Thank you, Mr. Pastor. Talking about your activity and exercise, how is your usual exercise pattern in the day?
My usual exercise pattern is, I wish I could remember that exercise machine, what you call it, upstairs in our room. Elliptical.
Elliptical.
That's right. I'm trying to, my mark would be the minimum of 3 miles daily.
Okay.
Uh,
You did mention that.
yeah, and I've been lacking in that. I am doing it more like every other day now, but I wish I could do it at least every day, and more than 3 miles if I can, and that would be just the minimum that I should do.
Okay. Do you need any assistance in your normal activities of daily living, such as feeding or bathing?
No.
Okay.
I do that by my own,
Very good. And
on my own.
what would you consider your leisure activity?
My leisure activity would be reading
Okay.
and
Very good.
do a little bit more of walking maybe outside. That would be leisure for me, and especially with a member of my family, if they could come,
Okay.
that would be leisure for me.
All right. Let's talk about your sleep and your rest. Would you say, how would you describe your sleep pattern?
My sleep pattern is relatively alright at this time. Like I mentioned to you before, I go to the bathroom at least 3 times through the night,
Okay.
and I may go there more often when I have not so good dreams through the night.
Okay.
Like last night, I dreamt about giving anesthesia when I'm not supposed to be giving it anymore. And in the concern that I may not have any malpractice insurance.
Okay.
That was the kind of scary part of it that made me awake more than usual going to the bathroom. But when, by and large, when I don't have bad dreams, I don't usually go to the bathroom that often.
Okay. What about any daytime naps? Do you?
Yeah, occasionally, maybe, especially now that I'm so-called retired,
Okay.
I can get more naps than I used to.
Okay.
I usually get sleepy after lunch, and I may have maybe a 1-hour nap sometimes, and sometimes that has gone to 2 hours, which is not good, I think.
Okay. Do you use any sleep aids?
Not lately.
Okay. Let's talk about your nutrition. Let's see. Record 24-hour diet recall. Well, that's not within here. Your nutrition. Is this menu? Okay.
All I can say about my routine as far as I could do better with scheduling breakfast.
Okay.
Maybe that has been disrupted because we had been waking up too late, and sometimes breakfast becomes lunch,
Okay.
and then comes supper. You know,
All right.
routinely breakfast should be the heaviest among the three meals that we have, but that hasn't been true lately.
Alright, who buys the food and who prepares it?
Mostly my wife and I buys the food, but almost always she does prepare the food.
Would you say that your finances are adequate for the type of food that you
Uh, yeah, so far I guess we've been doing well with financing well the food source that we have.
Okay.
That hasn't suffered lately. The only thing is when we go on vacations, like the recent one we have, the disruption of the food serving and the kind of food that we eat has been has suffered, so to speak.
Who is present at your meal times during like recently?
We try to take our meals together,
Okay.
especially now that it's vacation for the kids from school. And me being so-called retired, we try to eat the meals together
Okay.
as much as we can.
Very good. Talking about your interpersonal relationships, how would you describe your own role in the family?
Well, again, that could be a room always for improvement. Being the father of the family, I should be more patriarchal, so to speak, to lead the family to the direction that we should go.
Okay.
We should be eating together, praying together, do as much activities together as possible. But I think at this point everyone has his own agenda. With my younger son, preparing for the test, then he will have to devote more time for his review.
Okay. How would you describe how you get along with family, friends, co-workers, or classmates?
I try to be interactive as much as I can with getting along,
Okay.
adjusting to whatever mood that we have in the states of life that we have right now. Yeah, there is always room for improvement with that too. Interaction, getting along is not as much as a problem as everyone trying to get along with each other.
Okay. When you face a problem, where do you get your support?
I get my immediate support from my wife,
Okay.
and then from there, I think trying to be spiritual, we are admonished to first of all bring our problems to the bottom of the cross, to God, which would be our most, because He's the one that can really help with whatever problems we have. And then from there, I guess we expand it to part of the family. If you don't relate to them the problem that you have, they could almost guess what it is. And sometimes I am freer to present the family myself, present to the family myself the problem that I may be, or we may be confronting.
Okay. Alright, how much daily time do you spend alone? And is this pleasurable or isolating?
I think I have been using time alone more now than I had ever been, mainly because of the fact that there is more assessment to what we are supposed to do as planning of the future is concerned.
Okay.
And it has been more isolating than what I wish it would be.
Okay. Coping and stress management. Okay. Describe the stresses in life now.
Well, the current stresses in life now compared to the past is more on sustaining and surviving financially.
Okay.
That has been the thing that bugs me
Mm-hmm.
currently. How do I sustain a family of this size, especially when it comes to education,
Okay.
which is basically the boys. With AJ going to dormitory school
Mm-hmm.
and Jeremy finishing his BS degree.
All right. Um, any specific methods you use to relieve stress? I understand you mentioned your wife.
The most specific methods that I do to relieve stress is, I think number one and foremost, the most important is praying.
Okay.
And then I go to attend prayer meetings.
Okay.
And I think that's the best way to, as a matter of fact, disseminate the stress level. Prayer.
Would you say that these methods are helpful?
I think it is the most helpful that
Alright.
I have utilized so far. And praying is the most effective way. And study of the word. It does answers back to you. And just by going through the routine of morning and evening, application of the word does help, because you feel like God is talking to you personally about how do you address the stress that you have in life right now when it comes to financial support, and also especially planning for the future, and addressing what really counts in life, the priorities that you should have, what really you can bring with you and what takes you there. Basically the question in life is most of the time where you want to go and how to get there, and where are you in the journey of where you want to go. So addressing those questions, I guess, is always the paramount thing in life, and if you want to be extremely spiritual, of course, where you want to go is the ultimate goal of heaven. And where you are, sometimes you don't know where you are, and what are you doing to be able to get there, is the most important question that you have always to address periodically, as often as you can, so that you will be able to get to that destination you want to be. So I think that answering these questions always settles the stability of your life.
Very good. Well, we're gonna get into your personal habits. Daily intake of caffeine. Would you say you drink?
No, I don't take caffeine. Coffee has never been the routine.
Okay. What about smoking cigarettes?
No, I never smoke.
Okay. Let's see. Drinking alcohol?
No.
Okay. Any use of street drugs, such
No.
as marijuana. Okay.
Being an anesthesiologist, I may have access to any drugs that would be habitual or addictive, but fortunately I didn't get to that habit.
Very good. Environment hazards, such as in your housing or neighborhood. Do you think you have any major environment hazard? Maybe like the type of structure your house is, or maybe your neighbors are maybe your hazard?
No, fortunately our neighborhood is environment hazard free.
Okay. Would you say it's pretty much safe area?
It is a very safe area.
Okay, what about...
We never use our alarm system.
Okay, good. Adequate heat and utilities.
Oh yeah, we have adequate heat during winter
Okay.
and
What?
cold during summer.
Very good. Access to any transportation.
Sure, we have access to all kinds of transportation
Right.
that we need.
You mentioned involvement in your church. Would that be the only involvement in community service that you would mention?
So far,
Okay.
that's the involvement that I'm into.
Okay. Any hazards at, well, I guess now that you're retired, you wouldn't have to mention any hazards at the workplace.
Well, I don't think even when I was working, I had any hazards at the workplace.
Okay, very good. Any use of seatbelts when you're driving?
Yeah,
Of course.
that's a must.
Oh, good. Do you travel to or reside in other countries?
No, that's not routine.
Okay. Okay, understood.
I haven't been to other country for a while.
Okay. Any military service in other countries? No. Okay. And we're going to ask you about your intimate partner violence. Now, how are things at home? Do you feel safe?
I feel very safe at home.
Okay, very good. Ever been emotionally or physically abused by your partner or someone important to you?
Fortunately not.
Okay. Have you ever been hit, slapped, kicked, pushed, or shoved, or otherwise physically hurt by your partner or ex-partner?
No.
Okay. Has your partner ever forced you into having sex?
I wish she had.
Okay.
No, but I never. No to that.
All right. Are you afraid of your partner or ex-partner?
No.
Okay. And we are coming down to the last few sections. Occupational health. Okay, please describe your job or what you used to work as.
Well, my job was giving anesthesia to patients who undergo surgery.
Okay.
So it's not very. It can go to two extremes, which is it could go boring or too exciting at times when you are saving a life, especially. When things go right, then it might lean more into the boring side. But when things go wrong, then you could really, pee on your pants, so to speak, and really get very extremely agitated.
Okay.
Because basically you determine the success and failure, life or death of some patients sometimes. And it's either that you administer it yourself or you supervise nurse anesthetists under your care.
Do you work with any health hazards? For example, asbestos, inhalants, chemicals, or repetitive motions?
We have a lot of repetitive motions. We are exposed to anesthetic agents,
Okay.
which I don't think are health hazards.
Okay.
Some people attribute these agents to early abortion if you are carrying a baby.
Okay.
But other than that, the only health hazards that you may be exposed to is if you are tempted to use those drugs to yourself, other than the patients you administer to, then you might be exposed to addiction.
Okay.
Or possible habitual use of it.
Okay. Talking about the access to being addicted, would you say that there's any program that is designed to monitor you or your coworkers' exposure to such chemicals? Is there a program to help prevent such exposure to happen?
Well, the only program that you could that could prevent is the ability to personally monitor yourself
Okay.
in such a way that you are not tempted to steal any of those drugs. If it is a matter of personal, what do you call this?
Integrity?
Responsibility.
Okay.
Uh,
Integrity?
personal integrity, personal way of not exposing yourself to, because the temptation, if you are addicted to these drugs, the penalty to it is very radical in such a way that you can lose your job, you can go to jail, and you can be branded as someone who will eventually not being able to get a job at all, because if you are labeled as somebody who is addicted to narcotics, I mean, your competitive ability to get a job is virtually zero.
Very well. All right. And what do you like or dislike about your job?
Oh, what I like about my job is it's relatively, you know, consistent. It's not difficult to have it if you are marketable. Now, what I don't like about it is you are subservient always to some higher ups. Like for instance, you always have to serve someone. Like for instance, you have to serve the administration of a hospital. In other words, you cannot exercise your job without a hospital there for you to use it, or a surgery center for that matter. That's the thing. You have to depend upon either a hospital or a surgery center to exercise your job, and without it at home, you cannot do anything about it. And also, you are not at liberty to dictate more or less your future, for the same reason that you have to serve those guys in order to have a job at all. So you have to serve other doctors in order for you to be successful in your job. You have to please them, so to speak. They have to regulate you, or to have give their impression about you. It may hold with it may be true with any other job anyway, but that part I don't usually enjoy, so to speak, where it's not unlike the primary caregiver, so to speak, like surgeons, internists. In our profession as physicians, there are 4 specialties where you have to serve a hospital, which is number 1, anesthesia, radiology, pathologist, and there's another one. Did I mention radiology?
Mm-hmm.
Yeah. I may be omitting one of them. Pathologist, radiologist, anesthesiologist, and
The surgeon?
no. The surgeon has, anyway, the surgeon doesn't need a hospital to practice. He can practice, at his office. Anyway. So, so that's the if I were to do it all over again, I would go to a line where those would be totally eliminated.
Okay. All right, talking about the perception of your own health, how do you define health?
I would define health as satisfying the more or less 3 aspects of it, which is the physical,
Okay.
Physical in the sense that you are physically healthy.
Okay.
You are also emotionally healthy, meaning it would satisfy the emotional part of it, which is the mind.
Okay.
And then the third aspect would be spiritual. If you are spiritually healthy, meaning you are satisfying the horizontal, which is the relationship between you and everybody else. When horizontal, I mean human being, the interaction with you and other human beings. And then the vertical is the association or addressing the relationship between you and God.
Okay.
That's the spiritual aspect to it. I think if you satisfy these three things, then you are virtually healthy in the aspects of life. The physical, the emotional, and the spiritual. The triangle.
Okay. How do you view your own health now?
Again, I view my health in those three aspects.
Okay.
If I can take care of the emotional aspect, the physical aspect, and the spiritual aspect, which I think I have addressed and keep addressing during the course of this interview, I think we'll be fine.
Okay. What are your concerns regarding your health, if any?
When it comes to priority, again, according to their priority, I would address it in three ways. And that is, again, going back to spiritual. When I address spiritual matters, which I think is the more important part of the three, if I am okay with spiritual, I think the physical follows
Okay.
as well, and then emotional would follow the third. If you put things in their proper order, in their proper place, and you address them in that order, I think you are pretty much solid in your health.
Okay. What do you expect will happen to your health in the future?
Well, like everything else, as you age, no matter how good you address your health in those three aspects, they will eventually boil down to what you call death.
Okay.
No matter how much you take care of it.
Mm-hmm.
Now, if you address them in that order, spiritual being the first, and then physical, and then emotional, I think that you will be more settled in the future and satisfied, so to speak, and satisfied in the sense that you will be able to know that you have lived a life that is secure to you, satisfying to you, and that if you address those, you will more or less live a life that that is most satisfying to you
Okay.
at the end.
Do you have any health goals?
My health goals? Well, again, I address them in those three aspects.
Okay, very good.
Spiritually, if I satisfy the health goals, spiritually, then I'm pretty much golden.
Okay.
And then physically, if I satisfy that too, and emotionally, you know, the goal is to satisfy those three aspects of health that I know of, which is, again, spiritual, physical, and emotional.
Okay. And my last question for you is, what are your expectations of the nurse and the physicians here at this hospital?
Oh, okay. I expect that the nurse and physicians that address my health would also address, I hope, those things that I emphasized.
Okay.
That even though being a physician, they would mostly address my physical aspect. But then it would be nice to mix the other two together. Because like I said, believing in a total health package, those other aspects, if you address them as well, will make the whole package satisfying. And I expect that my nurse would help me with the needs of nursing in my life. But at the same time, I would love to hear her or him being able to say, you know, as far as I'm concerned, I will help you with the nursing care as much as I can. But on the other hand, I will also pray for you
Okay.
and support you emotionally. If there is ever anything that I can do, even outside of my realm of expertise, I am willing to go all the way with you, to discuss with you, to guide you, and along the way, if I can personally help you, then here's my number. Call me whenever you need me, and I'm open. And if my physician would do the same, then I would feel more secure about it, that even though he has or is helping me with my physical attainment for an optimum kind of health in the specialty that he has, whether he is a cardiologist, surgeon, or any other kind of specialty, if the bottom line is service to others, you know, like he opens his heart to any problem I might address, whether it may not be related to his specialty or not, then I think that would be the best relationship that I can have with my caregivers.
Very good. I've asked you a lot of questions. Do you have any questions concerning anything that we just went over for me? Do you have any questions for me?
Knowing that more or less our health system is seemingly getting worse rather than getting better, I would like to know, what do you have in hand or in your pocket, so to speak, in your resources? What are the ways and means to make our health system more viable, more enjoyable, or helping to other people who may not be able to afford it? And especially nowadays, there are many people who cannot afford health insurance. What ways and means are you guys doing to relieve this system that we are in, so that we can extend our help even to those who cannot maybe afford it?
What are we doing? Well, I do not have enough personal experience with that area, but I am more than willing to do some research to figure some of that out. But I am very much aware of the healthcare problem or crisis that we might be going through. But if you have even more further deeper questions regarding that, I can direct you to a physician or a social worker if needed. But
I think that's fair enough.
if that's the only question you have, that's all we need for your interview, and we can get right on started with your healthcare here in this hospital. So,
Okay.
is there anything else I can do for you?
No, you have been very helpful, and you have been.
Okay.
I think you have the art of listening to my questions, and you have been very detailed on the questioning, and I hope I have addressed all the questions that you want to know about my health, and especially you also broaden the scope of what we mean by what we really need to help as far as in order to have a very healthy relationship, not only physically but spiritually and emotionally as well.
All right. Well, thank you very much, Mr. Pastor.
You're very welcome.
I hope you have a good day, and we'll see you on the 3rd floor.
Okay, thank you.
All right.
And God bless.